Okay, so we're excited this week to welcome Dr. Arunde Drakes for our colloquium presentation. Dr. Drakes is a hazards geographer working at the U.S. Geological Survey office in Norcross, Georgia, which is in the Atlanta area. In his role with USGS, Dr. Drakes' work focuses on social vulnerability in multiple hazard contexts and its implications for disproportionate hazard exposure, impacts, and recovery. His work contributes to USGS initiatives such as the Social Dimensions of Water program, the Water Hazards Program's Stakeholder Engagement and Emergency Response Project, and the Environmental Justice Task Force, among others. His academic journey includes geography degrees from the University of Guyana, Coventry University, and he earned his PhD in 2021 from the University of Iowa. Dr. Drakes in 2022 won the Gilbert White Award for the best doctoral dissertation from the AAG Hazards, Risk, and Disasters Specialty Group, and he's currently serving as the director of the Hazards Specialty Group in the AAG. You can find some of his recent work published in top journals such as Environmental Research Letters and International Journal of Disaster Risk Reduction, among others. Please join me and give a warm welcome to Dr. Arunde Drakes.
Thank you for having me. And I believe my screen is up. So good afternoon, everyone. Thank you for thinking that I'm interesting enough to come speak at your colloquium today. I'm Arunde Drakes, and my talk will be on multi-scale, multi-hazard social vulnerability. It's probably not the exact title that was on the flyer, but I promise you that the content is the same. And this reflects a lot of the work that I did in my dissertation a few years ago. So to introduce myself, I am a hazards geographer, or at least that's how I see myself. Some of my friends might say that I'm a geographer who could be a hazard at times, particularly to them. And I am gainfully employed, but I'm not representing my employer today. This is content that was done while I completed my studies at the University of Iowa. So just getting that piece out so that I don't get in trouble later on. So how I got here, basically, because it's kind of important to what I'm talking about. So I grew up in Guyana in South America. So I'm culturally West Indian or Caribbean. And being from Guyana also means, like most other people in Guyana, I grew up on the coast, below mean high tides. So freebies for guessing what I study, right? Guess that's no surprise. And I really started out looking at vulnerability mapping for floods and trying to understand the unequal distribution of flood-related suffering. Then I started looking at the effects of sea level rise on the coastal defenses of my home region in Guyana, because growing up, I was always told we were 5 feet below mean high tide. We're a lot more than that now. And I worked on designing risk assessment databases to be used by and incorporate knowledge from indigenous communities all across Guyana, and then developed regional scale hazard and vulnerability assessment methodologies, which are now utilized by Guyana's National Disaster Management Agency. Then after all of that, I went back to school to do a PhD and officially started investigating all the stuff that I was already talking about and already investigating and already asking questions about and having long debates with those around me for social vulnerability and multi-hazards. And that's what I'm going to talk about today. So just to outline this presentation, I'll speak in the context of natural hazards, and a natural hazard in this context is anything with the potential to cause harm. And of course, we're looking at those things from a natural origin. And I'm really interested in the human part of natural hazards more so than the physical. And let's underline that a hazard only escalates to a disaster due to those human interactions. So that human part is really important. And so I'll give a synopsis of my research areas, followed by a brief discussion of the three major themes covered in my dissertation. And I'll try to pull everything together in a coherent manner. And if I'm not being too boring or gone over time, we'll have a short discussion, hopefully a lively discussion afterwards. So we know that hazards are not equivalent to disasters, and that an event could be simply a nuisance for one person or a group of people, and simultaneously be absolutely devastating to another person or another group of people. And so my talk today is about the social vulnerability producing conditions that transform these physical hazards into those social, institutional, cultural disasters that we typically think of. And I'm really interested in the social aspects of why people become exposed, why they suffer losses, the disparities in that suffering, and disparities in the subsequent recovery from that suffering. And that's essentially the elevator pitch for social vulnerability. So how about we start with an exercise? I want you to close your eyes and visualize a disaster. Who do you see suffering? 3, 2, 1. Everybody ready? I don't see any nodding heads. So I'm just assuming, I see a nodding head now. Great. So who did you see? Was it the elderly, the frail, women, children, minorities? Sounds about right? I see one nodding head in the back. Great. It's those socially vulnerable conditions identified in the people you just saw in your mind's eye that increase the likelihood to suffer harm, that can reduce the ability to deal with the impacts of those harms suffered, and usually that pushes certain groups of people to be in more dangerous, more hazard-exposed situations in the first place. And research has shown that this social vulnerability is increasing disaster losses. And climate change is pushing already vulnerable populations into even more precarious conditions, while exposing new populations to hazards. So we're dealing with combinations of these events, whether they occur simultaneously, in sequence. I see big houses on the beach. Great, we'll come to big houses on the beach just now. So it's multiple hazards, especially for those people with big houses on the beach. And we aren't dealing with those issues as individuals by ourselves. It's also as communities, as municipalities, as counties, as states, as regions, as nations, as a global population. So it's also multi-scaled. So as you can imagine, there's real complexity to this issue. All right, so these days, we like to measure everything, particularly where it comes to resource allocation. And we really rely on quantitative measures to show impartiality in the decision-making process. And this helps institutions to address concerns of procedural justice. So increasingly, decision makers are relying on data sets from the census or similar agencies to understand the types of resources and the services that they need to provide, and to which populations they need to provide those to. And data which quantifies some element of these conditions that you just talked about is what's being used. And we call those, in my world, indicators. They're just measurable proxies of these theoretical concepts that we study. And they're quite valuable for reasons just spoken about, right? But they're not infallible. Wanting scale of decision-making often means that indicators associated with small populations get eroded or washed out as we aggregate data up to larger sizes, larger populations, larger geographies, which is the scale at which the decision-making is actually happening. And by themselves, indicators don't tell you about the local context in which they're active. And if we focus on the indicator too much, we can lose sight of the processes that they're really meant to represent. Now, as an example, we often identify indicators of race or ethnicity when we talk about vulnerability, right? I'm Black. Being Black does not by itself make me vulnerable to natural disasters in the US. Natural disasters. It's the underlying processes of racism which produce disparities that continue to make minorities more susceptible to suffer harm, less likely to cope with those harms, and really more exposed to current hazards that we're actually referencing when we identify these indicators of race or ethnicity. So if we lose sight of that process, we're losing the context in which that data is being presented. So let's talk about multi-hazards for a bit. Now, we typically study societal hazard interactions in isolation. It's one hazard in a vacuum, and that's a good starting point. But we know that's not really the reality of most places, right? We have multiple groups facing multiple different types of events. And much of my work falls under that umbrella of multi-hazards or multiple hazards. It's not just that I'm interested in floods or droughts or hurricanes or wildfires. I want to study all of them. And so multi-hazard seems pretty straightforward until we start asking the question, well, what do we actually mean by multi-hazards? See, one of the strengths of this area that I am in, hazards and disasters, is that it's interdisciplinary. But that interdisciplinarity also brings challenges. We've got social ecology, political economy, geography, climate change, risk, sociology, emergency management. And we're all using the same or very similar terminology, but we're often describing different things. And so that means it's really confusing when we talk about multi-hazards. What I really want to know is how societies, communities, households are interacting with the natural hazards they face. What are the trade-offs? Do they privilege preparedness or mitigation for one hazard over another? Why? Are there factors that drive this type of decision-making? Is this broadly multi-hazards for one area, but mainly a single hazard for a different area? And then not every conceptualization of multi-hazard would look at those types of interactions in the same way. And this has very meaningful implications for the way we approach studies and the methods that we use in research, and therefore the interpretation of the results that we come up with also, right? So in the first paper that I'll talk about, I try to understand which elements of social vulnerability are typically assessed in each conceptualization of multi-hazard. And find what are the geographic and temporal scales used, what disaster stages are being investigated, what methods are typically applied, what characteristics of vulnerable populations are being assessed. And so I try to start from a clean state of multi-hazard, right? And I conducted a meta-analysis to identify and profile the conceptual approaches to multi-hazard assessments used in the literature on social vulnerability. And that methodology is being put up on the screen right now. Data collection was based on keyword searches from the Web of Science and Scopus databases. And I basically had to review every abstract to weed out those that weren't necessarily applicable, and then go back and read every paper for all of those that were deemed relevant. So I ended up covering 107 papers from the past 20 years or so. Try doing that in the middle of a dissertation. Well, multi-hazard turns out to really do mean different things. And the literature shows that natural hazards and disasters fields really describe different associations of hazard events when they talk about multi-hazards or multiple hazards. And I found three major concepts: aggregate hazards, which examine the accumulation of impacts from independent events. They usually look at several hazards individually and then tries to sum all the effects. And this is the approach that's usually applied in hazard mitigation plans under the Disaster Mitigation Act of 2000. So it's kind of important to study. It's computationally probably the simplest approach also. Then there is cascading hazards, and that occurs where one hazard triggers another hazard or another group of hazards. Think about a hurricane triggering inland flooding, which then disrupts power, which then triggers chemical spills. And those usually refer to instances where two or more hazards interact or intersect to trigger secondary hazards, as we see in figure B2 in the middle here. And then there's compound hazards, which describe the interaction of hazards which may be single extreme events or multiple coincident or sequential events. They're correlated in space and or time, but their causes are really distinct and they produce effects which would not have actually arisen without their interaction. For example, think about the island of St. Vincent responding to the COVID-19 pandemic and then having to evacuate and shelter 1/3 of their population from the northern half of the island due to the eruption of the La Soufrière volcano. Those two things separately are very different from the combined effects that we see. So in this particular figure, the color intensity identifies the scale of the correlation coefficient, and the circle size is proportional to how often an indicator was used to study that determinant in each of these contexts for aggregate, compound, cascading, and then all of the data. And so we found that hierarchical clustering revealed distinct associations of the determinants of social vulnerability across different classifications of what we consider multi-hazard, and demographic characteristics, socioeconomic status, and to some extent land tenure were the most important drivers of social vulnerability in multi-hazard papers. However, that really only describes the frequency of them being measured together. It doesn't actually illustrate the form of that relationship. So that's something to note. Exposure was always weakly associated with all of the other determinants of social vulnerability. And this looking at correlations and clustering suggests that it's the cascading classification which most evenly addresses the 8 determinants of social vulnerability that we measured across these 107 papers. Now, what we also found was that the application of multi-hazard was pretty conceptually narrow, as you can see here highlighted. Literature on social vulnerability in multi-hazard context was dominated by the aggregate classification and the mitigation phase. That's a problem, right? Since the vast majority of multi-hazard papers are adopting this aggregate approach, it really means that empirical knowledge mainly assumes that the effects of individual hazards can be assessed separately and then linearly combined. And the primary focus of those studies happened to be on quantifying the impact of natural hazards on physical or economic outcomes, while only controlling for social factors like age or family structure. So we might be missing something there. The intersectionality of marginalization producing processes can't really be adequately interrogated using that approach, at least not in the way it's currently being implemented. And so understanding how social vulnerability functions in the cascading and the compound senses is pretty imperative, as it's the social inequalities which transforms hazards into disasters. And we know that cascading and compound events are likely to become more dominant in the future century. So the takeaways here is we still don't really understand multi-hazards. There are distinct perspectives of social vulnerability being covered by each of these different multi-hazard classifications. And so they may be providing different information about social vulnerability, which means researchers and practitioners have to be cognizant of this and maybe actually start intentionally seeking out empirical studies from different classifications of multi-hazard in order to get the full picture of what's really going on. And empirical studies are limited in what they measure. So expanding our focus is really needed. And if we're thinking about global change context, it's absolutely necessary right now, right? Because we know relatively little about how multi-hazard social vulnerability operates in the response and the recovery stages, or with health-related hazards, for example. Everything outside of the aggregate classification. And I really believe that the tools for improving those two things I just talked about exist in looking at the cascading and compound classifications of multi-hazards. So now that we've got a quick overview of what we're really talking about with multiple hazards, let's drill down a little bit and move into the real fun stuff, right? We've done a lot of conceptual work so far. So let's go to actual data that we're using to get outcomes. So let's look at disaster assistance. And this next research step was to determine how multi-hazard social vulnerability affects hazard outcomes. And I'm illustrating this need for considering social vulnerability looking at disaster assistance. Now, the use of available resources to absorb impacts and to manage needs is highly influential in creating disproportionate disaster incomes. That much the research tells us. And it's really a core component of social vulnerability. Households rely on insurance, on personal savings, on social capital to withstand disaster effects such as job loss, damage to their residences, or loss of personal possessions. Households with fewer resources are less able to overcome those challenges. And federal programs respond to those unmet coping needs. They represent a significant proportion of disaster assistance, and they're available nationwide. So it's really good to study them. FEMA's assistance is the bulk of what's available, and FEMA's individual assistance program is the principal program which affects or directly targets households' unmet needs. This is really short-term assistance, providing additional means to address deficits with that ability to cope. But it's really unclear who receives that assistance and is it enough for their needs. See, one of the critiques is that these programs typically rely on the dollar value of damages or loss to determine disbursements of aid, right? How much money you're going to get. And that's problematic because past research has shown that we may not be meeting everything for everyone. And it's really inconclusive about the relationship between coping capacity and the receipt of that assistance, particularly the individual assistance programs, IHP, or individual and households program, which is by far the bulk of individual assistance. Socially vulnerable populations may be more likely to receive assistance under that program, but it seems like they receive less assistance while suffering proportionally greater relative damage than their neighbors. And this is all while having fewer resources to actually overcome that loss. So in this paper, we explored the locations and population characteristics of places that received assistance under the individual and households program across the conterminous 48 states from the year 2006 to 2018. And we assessed IHP during this period at the zip code level, which is the lowest aggregation that was available. Actually, we used the zip code tabulation area, which is the geography that's assigned to zip codes. And we assessed homeowners and renters differently as we thought they were separate populations. We aligned this to social vulnerability using Cutter et al.'s Social Vulnerability Index, or SOVI. And we used the average of 2 5-year estimates and filled in any missing data using a natural neighbor interpolation method. That's important because the census does not give you information for a particular variable if they think it would allow you to identify individuals. So there are different parts of the country where different variables were missing. So to account for the irregular size and the geographic arrangement of individual assistance receiving zip code calculation areas, we implemented a k-nearest neighbor spatial weights matrix and use a bivariate Moran's I to assess how the level of individual assistance was provided at each sector and how that was related to the intensity of social vulnerability at all the surrounding sectors. The dependent variable was the average total individual assistance, and the independent variable was SOVI score at each sector. The model identified regional and local variances in social vulnerability and FEMA individual assistance relationship. And that reflects the interactions of these multiple hazards over this 20-year period to which that population was exposed, as well as local social demographic conditions of that population. We then used spatial regressions to determine the statistically significant relationships between social vulnerability and individual assistance. And the average damage per event was used as the temporal aggregation would have otherwise caused comparison of zip codes suffering different numbers of IA receiving disasters. The dependent variable was the average IA or IHP funding, and we used a robust Lagrange multiplier to test for if it was appropriate to use OLS or spatial lag or spatial error models, and a maximum likelihood and AIC tests were provided for indications of model fit. So we actually did a fair amount of spatial statistics here. The interesting part of this, we found that there are distinct patterns of disbursement of IHP associated with social characteristics of places receiving IHP. So low levels of IHP were associated with high levels of social vulnerability. That's the red stuff you're seeing in your image. And that's suggestive of places where IHP may be underperforming or not adequately reaching the needs of those most in need. And we found those places were clustered in the Mississippi Valley, in the Southeast, right, in Appalachia. And they were mostly rural. Conversely, places associated with high levels of IHP and low levels of social vulnerability, so where the program seemed to be overperforming, providing more assistance than you'd expect, those were clustered in the Northeast, in the Midwest, and they were usually urban in nature. What we found was that the value of damage suffered was a major predictor of the amount of aid that was actually given to a location. And we computed an allocations versus damage ratio, which generally suggested that alignment was found between damage and assistance received. But that doesn't tell you the entire story, because you see, impaired coping capacities reduce resources that are available to households. And this makes the need for assistance more acute than the dollar value of damage alone will tell you. So we needed to assess how social conditions, so social vulnerability, influence assistance. And we found that the reliance on dollar damage may actually be driving inequity in how assistance is distributed. For homeowners in places where IHP seem to be overperforming, the high-low places here, aid disbursement fell as the proportion of minority households, Asian and Black households in particular, rose. where IHP appeared to be underperforming the low-high places, among the homeowner population, assistance rose with the number of unoccupied houses. So houses that are typically either unoccupied or only semi-occupied for part of the year. Among renters in those locations, places with higher populations of non-married couples and lower income families received less IHP than their neighbors did. And these are social conditions typically associated with greater marginalization and limited resources. So programs aimed at shoring up coping capacity would be expected to distribute more aid to these places, not less. But this is what we're seeing, right? Further, homeowners in particular, IHP was influenced by population characteristics at the surrounding locations. That's your spatial error model. Existing societal differences may be influencing access to and the amount of assistance received by homeowners. And homeowners are the major beneficiary of individual assistance from FEMA. Now, latent influences of societal disparities can impact loss due to the effects on aggregated wealth and the value of property and the value of possessions exposed to hazards. And that subsequently influences the received assistance. And we think that's what's happening for homeowners. For renters, it's a different case. The value of IHP was actually better explained by IHP at surrounding locations. So that's the spatial lag model. And the takeaway here is that there is something about the structure of the program that influences disbursement to renters. And that finding likely represents the reliance of the dollar value of damage and the fact that for renters, IHP only covers damage to their personal possessions, not to the structure itself. And there is also research that suggests that renters tend to occupy more hazard-exposed locations. And this is particularly so for low-income renters. So losses for them may actually be more closely aligned with that exposure and the resulting damage to their personal property. So if dollar damage remains the major factor for allocational decisions, then populations least able to cope and therefore most in need of aid may not actually be receiving adequate assistance. And just as an aside, this paper was actually cited in congressional testimony arguing why FEMA needs to upgrade their disaster assistance programs to account for social disparities. So this study really supports conclusions that the structure of recovery programs is as much a source of marginalization as social processes before a disaster event. And the result is really multiple recoveries with places characterized by more marginalized populations likely becoming economically worse off, while locations with more privileged groups gain greater benefits from disaster assistance. And under the current model, people who have less stuff or whose possessions or property are deemed less valuable will receive lower dollar damage, which means they receive less assistance, even though their losses may contribute to a higher proportion of their belongings, of their equity, of their savings, of their ability to cope with that damage. So while the program may be addressing concerns of procedural justice, it seems to have faltered on concerns of distributive justice. And this is far and apart from other issues about who qualifies for assistance, the types of assistance that they get, and disparities in the infrastructure and other common goods that exist before disasters. All right, so that one was heavy. Third part of this, trying to bring it all together. Let's look at the spatial variation of multi-hazard social vulnerability and practical applications and implications for developing and modeling social vulnerability in multi-hazard contexts. So up to now, we've talked about multi-hazards. We've talked about outcomes of social vulnerability when we think about hazard events. Now let's look at actually measuring this stuff in practice. See, hopefully I've shown you why it's so important to consider social vulnerability and to identify appropriate indicators of vulnerability producing conditions. But then the challenge is, how do we actually operationalize all of this theory, right? So far, we've pointed to disparities. We say these things happen, but how do we measure and improve things? Well, we typically use indicators for that. And they're great at showing relative differences between location A and location B. They also offer a pretty simple way to communicate that high-level information. And so they're pretty common aids to policy making for disaster risk reduction now. But indicators and the compound indices that they're often grouped into actually struggle to communicate why people are vulnerable. We just can say this place is more vulnerable than that place, or has greater levels of vulnerability than that place. Now, they're all purpose in nature, and so they tend to represent most people most of the time, while missing the actual intersectional nature of societal interactions. Decision makers also need to understand the distribution of different hazards and address the locally relevant social processes that determine how those hazards actually impact livelihoods. Remember, we talked about the process which the indicator is trying to represent. Now, this need can't be fully realized by the now dominant generalized indices, such as the Social Vulnerability Index I used in the last paper. And that's because they use a common set of indicators over very large areas. They're inflexible to variations in geography, in hazards, in population under study. And oftentimes they're really just looking at a single hazard in isolation. So we tried to develop a composite index that does accommodate variations in geography, does look at multiple hazards, does look at different populations under study, right? And to try to do all of this simultaneously. And because I lack originality, I call that index the Spatially Adaptive Social Vulnerability Index. So we've moved from SOVI, S-O-V-I, to SASVI. And I conducted this study for 3 administrative regions highlighted in green here of my home country in Guyana. And for those of you who are unfamiliar with this part of the world, Guyana lies on the northern coast of South America. It's 83,000 square miles, so it's just about, 20% larger than Florida? But with under 800,000 people, it's got about 3% of the population in Florida. And this study area covers about 430 villages and towns. And so that's about 24% of the national population per the last census. So there's a multi-pronged approach that we took here. We relied heavily on focus groups to allow participants to tell us what hazards and social conditions were active in the areas that they cover. And the participants were identified. This is this part of it here. And the participants, they really looked at identifying and ranking the hazards that affected their region, and then also try to tell us about the areas that were affected and the intensity of those impacts. And the National Disaster Management Agency, the Civil Defense Commission, which facilitated this part of my research, actually then used that methodology in Guyana's 7 other administrative regions. And that data was used to help develop regional vulnerability and risk assessments. We actually found that there are 8 livelihood themes covering 71 variables or indicators, and 7 social demographic themes covering 45 variables. Now, I used multi-hazard data developed from that participatory mapping and focus group exercise conducted at regional and at local levels to identify exposure to 5 hazards of greatest impact as identified by those focus group exercises in each of those regions. To create the spatially adaptive index, the multi-hazard data from these first steps was combined with multivariate census data. And I used a combination of hierarchical clustering and k-means clustering to identify unique livelihood conditions occurring throughout the study area. Members of each cluster were therefore more similar to each other than to members of other clusters. And here, members are really talking about villages or towns or parts of villages and towns. And hierarchical clustering determined the number of clusters present. And then the k-means clustering was used to describe the membership of those clusters based on the census data, using an analysis of variance to identify the variables which were statistically meaningful for defining the clusters. Indicators of social vulnerability were selected based on the combination of livelihood classification and the hazards present. And for each livelihood cluster, indicator weighting was based on the level of importance given to the respective theme identified in the focus groups in the previous steps. To understand the potential for improved utility of this new spatially adapted social vulnerability index, I then interviewed operations staff from the Guyana Civil Defense Commission and conducted focus groups with officers from regional governments and sectoral agencies. And they chose to meet as groups rather than to be interviewed separately. So the survey really explored the benefits and the challenges of utilizing each of these two models in local disaster risk reduction operations. And the participants comprised staff involved in policy preparation, in community-based disaster risk management, health department, education department, as well as their disaster response. So to start out, the Guyana Social Vulnerability Index using the Cutter model produced 8 factors representing 65% of the variance in the data. And data was really identifying villages as moderately low or average social vulnerability. Now, as an aside, the National Hazard Management Agency and the Ministry of Education both knew that I was working on this. And so they requested this data set to help with their COVID-19 responses because this was happening during the pandemic, during the lockdown. And so it was actually being utilized before the study was completed. And I did run the survey for the entire country. To be clear, 90% of Guyana's population lives within 20 miles of the coast. So much of these gray areas really do represent no population or very sparse and intimate impermanent settlements. It's not that there's just a lot of missing data there. Now, the new Spatially Adaptive Social Vulnerability Index produced much more varied outputs, and many of the very rural and predominantly indigenous communities were identified as moderately high or very high levels of social vulnerability, which is much different from what we saw in the last model. And in this image, the northern and central areas of Administrative Region 2, southern areas of Administrative Region 3, and pretty much the entirety of Administrative Region 9 can be considered indigenous areas. And many of the larger places are actually representing Amerindian title lands, which are similar to your reservations. Practitioners found that, and here we're comparing the models side by side. So practitioners found that the SASV index, the new index, more accurately represent their experiences of conditions on the ground than a traditional social vulnerability index adapted for Guyana did. And to put this into context, they were receiving this during the response to the pandemic, and in some places, a year after 2 back-to-back 100-year flood events. So they were pretty worn out with flood responses, disaster responses by this point.
All right, Orende, I just want to note the time. There's about 5 minutes left of the presentation.
Great.
So, yeah, thank you.
Great. Now, the alignment of this new model with practitioner experiences was actually linked to the ability to account for the specific livelihood and hazard exposure context in each village. And the model was better able to explain the multi-hazard context of this social vulnerability. Based on the improved context, practitioners actually identified this new model as valuable for decision-making support, as it was due to that ability to adapt indicator selection and weighting to the unique combinations of hazards that they were seeing in their areas of influence, particularly for the Pomeroon area of Region 2 and the entirety of Region 9. Practitioners describe this new model as identifying the context in which social vulnerability develops. And it was seen as an important tool for communicating that complex information to national level decision makers who were really unfamiliar with those local areas. Note, a change in government actually happened during the duration of this project. So the officials who participated in the focus groups and the participatory mapping were not the same as those who evaluated the indices at the end of the project. So takeaways from this is that contextually, the adaptive nature of this new index was its chief advantage. And disaster risk reduction practitioners were able to link relative levels of social vulnerability to physical as well as social context in their local areas. And practitioner assessment validated the utility of this model for their responses in Guyana. And outputs are already being used, right? The hazard assessment method is being implemented countrywide by Guyana Civil Defense Commission, their national hazard management agency. The multi-hazard assessment outputs have already been applied to regional disaster management plans. Guyana's adapted SOVI was used in monitoring and evaluation of the COVID-19 response at national level. This top photograph is of the Civil Defense Commission training exercise with an indigenous community. And that exercise was deemed necessary following the local level participatory exercises conducted for this research. And the bottom photo is actually the then commissioner of the Civil Defense Commission, the UNICEF Guyana resident representative, and the chief of an indigenous community meeting to exchange disaster management supplies. And that was a result of the social vulnerability assessments and disaster risk assessments that were done based on this research by the Civil Defense Commission. I'd like to thank the Civil Defense Commission of Guyana for facilitating my research in the third paper, Texas A&M University for providing the FEMA data on IA, and the GMAP and SEGA programs, which provided funding for my research. And thank you for taking the time out on a Thursday afternoon to listen to me. And I'll be happy to answer any questions that you may have. And I promise we'll get back to those big houses on the beach.
I have a question. Your designation of your spatial weight matrix that you used both in Moran and in the
Could you speak up a little bit, please? I can hardly hear.
Designation of your weights matrix as you ran in either the bivariate Moran models or the spatial regression models, because I know you ran both I saw you wrote the lag model or the spatial error correction model. Did you see if there was any sensitivity to how you designated? Because were you optimizing for the K nearest neighbors and finding the best model, or did you use the same weights matrix across the board for all of those spatial error and then the spatial lag models?
We used the same weights matrix, but it was initially optimized for the spatial distribution of sectors that received individual assistance, which is why we use the K nearest neighbor rather than just using a queen contiguity or one of the other methods.
Yeah, and I like the approach of using K nearest neighbors for the designation of the spatial weights matrix. It would have been nice though to see when you optimize a goal, a little bit below, a little bit higher in terms of the order of the weights matrix, and see how, if the results were sensitized at all or affected by those. Because I know, and one of the things I love that you left off the insignificant variables, because it really allows you to focus on that screen. That's a great thing. And I tell my students, why are you putting, insignificant variables in? So that was great. And I enjoyed your presentation very much. Thank you for answering my question.
Thank you.
A few more questions before we wrap up. I don't know, Kevin, if you had a question or something you'd like to add. I don't know if Kevin's here anymore.
Sure. Yeah, I'll ask a quick question. On the second paper, so obviously you use the SOVI metric in the analysis with the assistance data. Do you think that if you used a different, I know that SOVI is pretty widely accepted and used, but if you use, for example, the CDC version of their index, do you think you would get a really different result? Like, for example, in the bivariate maps you showed, do you think it would be widely different with a different vulnerability index?
I'm pretty sure it'll be different. I think in the most extreme cases, the very high of the high assistance, high vulnerability, and the very low of the low assistance, low vulnerability, we'll probably see the same pattern. But it's in the middle areas that I think the major differences will show up. Although I do like to say that one of the issues with using these types of generalized indices, though, we still run into the problem of it's a generalized index. And if it's, areas, for example, that are more facing wildfire may not have as good a fit as those that are facing floods or hurricanes, where most of the preliminary research was actually done for the development of those indices. So on the individual hazard type, we still have a major problem far and apart from the construction of the index itself.
Thank you. Yeah, that makes sense. I really like the paper. That was just one question I had. So that's all I have.
Well, let's thank Dr. Drakes one last time for taking the time to speak with us today.